The first step with acne treatment is topical therapy using creams or ointments. I think the mainstay of any topical acne therapy is a class of medication called retinoids. Retinoids are vitamin A derivatives that we use to prevent acne. So everyone wants that spot treatment. This is something that you apply to full face or chest or back to prevent new acne lesions from developing in those locations. The beauty of retinoids, like I tell my patients, is not only does it have anti-acne properties, but it also has anti-aging properties. You may have heard of retinols or retinoids to help prevent the aging process to stimulate new collagen. So I like to tell my acne patients, you're getting two birds with one stone. We're treating your acne, but you're also getting an anti-aging effect. The one downside with topical retinoids is it's kind of inherently drying. So it can make your skin a little bit more dry. And this is a product that is often inactivated by sunlight. So it's something you use at nighttime. And we do encourage our patients to layer a moisturizer on top of it. So first put it on clean, dry skin, and then you layer a moisturizer on top. That can help mitigate some of the dryness. But sometimes even in the seasons, we have to adjust the strength. So sometimes in the winter, we may adjust to a lighter retinoid because it's, the winter isn't just a more drying time of year.
Some other topical medications that we often use for acne are topical anti-inflammatories that also have some antibiotic activity. Sulfur is one of my favorites. Sulfur often comes I usually like prescribing it as a wash because it doesn't smell very good and I prefer taking that off of your face. But sulfur works really well for inflammatory acne, so I often will prescribe that for people that have inflammatory acne. Another product that we often use for its anti-inflammatory effects is Axone. It's actually a topical antibiotic that can be a good addition to a topical regimen also.
So topical antibiotics get a lot of publicity and historically have been the mainstay in terms of benzoyl peroxide and topical clindamycin, for example. We're finding less and less that topical antibiotics can be helpful, but they can also compound dryness, that is common when using with retinoids, and that antibiotic effect is helpful really in a unique subset, that more inflammatory cystic kind of papular acne. So some people have more just clogged pores or the hormonal component, topical antibiotics may be unnecessary. So it's finding that right regimen that will combine efficacy, so working, but also not drying you out, because sometimes just drying your skin out with all these caustic topical medications can just make you more red, irritated, inflamed, and make everything look worse. So sometimes topicals have their limit, and a lot of times our patients are hesitant to move on to oral therapy. But if your acne is severe enough or a unique subtype, topical therapy won't get rid of it alone, and that's where we consider oral agents. And there's really three categories of oral medications we use: oral antibiotics, Spironolactone, and oral Isotretinoin, or what has been known historically as Accutane.
I think one other thing just to think about is that often people have rosacea that is kind of either misdiagnosed as acne or in combination with acne, and I think it's important to identify that because there are a lot of products that can treat both rosacea and acne, and I have a lot of my patients on treatments, whether topical or oral, that cover both. And I think it's hard for a lot of people to know the difference, but that's kind of something that we cover at an office visit. But so going into oral therapy, one of my favorite medications for acne is Isotretinoin, which was also known as the brand name Accutane. I think this medication has a bad reputation, and we'll get into that in a minute, but it is one of my top 5 favorite medications because it's the only known cure that we have for acne. Everything else that we do for acne kind of helps you control it during the years that your body is making acne, whereas Isotretinoin actually, it's been shown that in 90 to 95% of patients, the acne goes away and doesn't come back, and in about 5% it either doesn't work at all or comes back. But even when it comes back, it's usually much easier to control.
And that data has really come from learning how long you stay on the medication, because while on Accutane, at first, initially, the first month or two, the acne actually might get a little worse. Your skin will get extremely dry. These are known side effects. But usually around month 3-4, your acne is pretty much clear. You'll be dry, and patients are often excited to stop it at that time. And what we know, if we want to get that 90-95% clearance, we have to reach a total dose depending on your weight, which has been adjusted over the past 5 years. We now know that reaching a little higher total dose can get us that 90 to 95% clearance. Usually that equates to around 6 to 9 months on therapy, depending on how well you tolerate it, because we often adjust dose the dryness gets too severe, we'll lower the dose, but you may have to be on the medication longer. The other thing that's required with this medication is we do monthly lab work for both genders, and partly because we're checking your triglyceride, which is a fat circulating in your blood. We want to make sure that doesn't get too high. And we also want to check your liver function. Now, the liver function risk, the risk to the liver was thought to be much higher than we now know, but it's still something that we should test for, though the risk is much lower. In women, the biggest risk is we do not want you to get pregnant. This medication is regulated by the federal government to really ensure that pregnancy risk is as low to zero as possible. So we have to get pregnancy tests every month. We cannot refill the medication, and this is critically important. So we do encourage our patients who are taking this to be on birth control, some form of birth control.
One of the things that many people have heard about isotretinoin, and which makes some people hesitant, some parents hesitant to have their teenagers on it specifically, is that there were some of the data showed that there were higher amounts of suicides in patients on isotretinoin. But it's hard to really kind of pinpoint causation on the isotretinoin because, one of the highest risk groups of patients for suicide are teenagers. So is it because of the isotretinoin, or is it because isotretinoin is usually given to teenagers and teenagers already have a higher risk? So it's obviously hard to say, but if anybody was on this medication and had kind of thoughts of suicide or changes in their mood, we obviously would recommend coming off, but that's not really something I have ever encountered.
And then what's the other oral medication historically has been used is oral antibiotics. Now, oral antibiotics can be really effective because a lot of oral antibiotics, not only do they decrease the bacteria, especially that one bacteria that lives on everyone's skin, but that can promote some of the inflammation, what we call P. acnes. It can lower that, but also a lot of the oral antibiotics that we use also in itself have anti-inflammatory properties. So they kind of decrease your immune system's overreaction to that bacteria. And these medications, that we commonly use, doxycycline, minocycline, even the newest sarecycline or Sacera. But some people even use other antibiotics like Bactrim. Now, the challenge with antibiotics, while they can be effective, they're short-term solutions. Historically, in the past, people have been on for months, even years, but we're learning more and more about the importance of bacteria to our overall health. Actually, we have more bacteria on or in our body than we have cells in our body. And 21% of all bacteria is found on our skin, whereas the number one area is actually in our gut. So whenever you take an antibiotic, it does affect your skin bacteria, but it also affects your gut bacteria, the bacteria that live in your mouth. And so there's more and more data coming out about the importance of gut, mouth, skin bacteria, overall skin health, or body's health. And so we're moving away from chronic antibiotics, and especially when we have other good options like Accutane and even Spironolactone for adult female acne, our oral antibiotic usage here has decreased quite substantially, partly because of the safety profile that these other medications have compared to oral antibiotics.
Spironolactone was just mentioned, and I just want to kind of cover that briefly. Spironolactone is a blood pressure medicine that we use for its side effect, and because its side effect is that it kind of blocks the effect of male hormones on the skin. Both men and women have male hormones, and they can be responsible for hormonal acne in women. So spironolactone is a medication that we often give for kind of adult female hormonal acne. We use it at lower doses usually than those used for blood pressure, so it doesn't typically affect blood pressure at the doses we give it. Generally very well tolerated, and I think the most effective treatment for hormonal acne too.
Yeah, no, it is probably the number one medication I prescribe in my practice. It works wonders. The biggest thing we worry about is just why you get pregnant while taking it. So often we encourage patients to accept the medication, or we tell them, really to practice safe sexual practices while on it. But other than that, the side effect profile is excellent. It can be taken long term. It is a blood pressure medication. It's designed in the blood pressure community to be actually used indefinitely. So we find the safety profile is wonderful, and it's a great option for adult female acne, which I think in our practice is increasingly more common. Women in their 20s, early 30s that are still getting those kind of cyclical breakouts, especially in the lower face.
And on that note, I'm often asked, if I have hormonal acne, does that mean something is wrong with my hormones? And although that's possible, most of the time there's usually not a hormonal abnormality, and it's just kind of we don't fully understand it, but
it's a sensitivity. It's a sensitivity to male hormone. There are some women who have a true hormonal abnormality, but the signs are they're besides just acne. those women tend to
Hair
have
growth
hair
and-
growth on their face, hair thinning, weight gain. So there's other signs, high male hormone levels that appear, but the majority of women don't have those signs, and further workup, in terms of labs, are unnecessary. That concludes our acne breakdown. It's a big topic, and we could go on and on forever, but hopefully this gives you a good overview. And this is our sit down series. Dr. Terrence Keaney.
Dr. Lina Naga. We'll see you next time.